Hi, today I'm going to be going over precocious puberty with you. Precocious puberty is the sexual development of a female of the age of 8 and under and the male of the age of 9 and under. There are two different types. There is central precocious puberty and peripheral precocious puberty. 80% of all precocious puberty is diagnosed with CPP. It is more common in females than in males, and it's unknown the cause. The process of puberty and the release of hormones runs in the normal course, but it just starts too early. And usually the children who experience CPP have no underlying medical conditions. Peripheral precocious puberty is less common and it occurs without the gonadotropic releasing hormone. It is caused by the release of testosterone or estrogen due to the insult to the child's pituitary gland, adrenal glands, testicles, or ovaries. Risk factors are just being a girl, being an African American, being obese, and exposure to hormones like estrogen or testosterone, and then having received radiation therapy to the central nervous system. So signs and symptoms for females, it's the early growth of breasts or the early start of the first period. Males, it's an enlarged penis or testes. Then there's also facial hair, usually starting at the upper lip. Then it'll have voice deepening. So for both females and males, they both get body odor, acne, rapid growth in the beginning, and then pubic and underarm hair. So to diagnose this, first, the physician will need to obtain a detailed family history, asking about the onset of puberty and from the siblings and the parents. Obtain a detailed patient history, so asking about when the secondary sex characteristics first developed, and any type of exposure to any sex hormones like the estrogen or testosterone, which comes in creams and ointments that their parents could have, and if the child has gone through any type of radiation therapy for leukemia or tumors. So you also need to compare the patient's growth to a growth chart to determine if the patient has had the pace of growth that the patient has had. Using the scale, the Tanner Staging Assessment Model, to determine if the physical exam to determine the early signs of puberty. A radiograph of the left hand should also be taken to determine if or what the bone age of the hand is, because a patient with precocious puberty will have an advanced bone age, but it won't match their chronological age. You'll also do blood work to determine the hormone levels. And then they'll also do an MRI to determine if there is a lesion on the central nervous system. So medication and treatments. So due to the indications that precocious puberty has in the patient's adult height, the most important reason to treat the precocious puberty is due to that. And an untreated female will have a height loss of 10 centimeters, where a male will have a height loss of 20 centimeters. Treatment is aimed towards the cause if it's known. 50% of all cases actually stop advancing or regress on their own. CPP can be managed with a synthetic luteinizing hormone releasing hormone that it's administered monthly. The dose is 0.2 to 0.3 mg per kg every 4 weeks. And then treatment is discontinued when the child has reached the appropriate age for puberty. So the most important portion of this is the patient and family teaching, as you need to help educate the parents how to help the child with the physical changes that they'll be experiencing. So like helping them dress appropriately for their age, helping them with age-appropriate activities, the use of deodorant. Then once the central precocious puberty, if they have that, then they'll actually go through the main course of puberty, so you'll have to talk to them about masturbation and peer influences. We also need to help to remind the parents that even though the child may look older, their chronological age is congruent with their mental age. So during the examination, you'll need to ask the child how he or she feels about their development, as early maturation can lead to psychosocial consequences, as of social, antisocial behavior, substance abuse, sexual behaviors. You also need to make sure that you reassure the child that they've done nothing wrong and they can still live a normal life. This can help with the anxiety that is associated with precocious puberty. One of the biggest things is that ongoing education. It's helpful for the child and the parents to help navigate through the emotional and physical changes that the child is going to experience. Thank you.